Welcome to Dr. Nasar Shahid Forum for how we can achieve well-being, how we can prevent chronic pain and other chronic diseases. Now in this vlog, I want to talk about blood pressure. Blood pressure, which is the pressure inside the vessels, especially the arteries, but the whole vascular system that takes blood to every nook and corner of the body is a very important point. As we age, as we become more mature, actually these vessels become rigid. Why they become rigid? Because they lose their elasticity. Normally, if there is a little more blood going through it, it stretches the walls. So as a result, when it stretches the wall, there is more volume. And when there is more volume, you can have the normal blood pressure. But the problem is, as we age, these vessels become rigid and now we have less volume. So when there is more need of blood, they exert pressure on the walls of the vessels. How we can have a normal blood pressure as we become more mature? Naturally, the blood pressure problem could happen because of some other diseases. So that is called secondary hypertension. Right now, I'm not talking about that. Whenever your blood pressure number goes up, first you make sure that it is not just an incidental finding. It has to be done 3 times at least in the same environment with the same cuff size, so that now you can say my blood pressure is high. So question is how we can prevent being hypertensive. There are 2 aspects to it. One is that our sympathetic system is oversensitized, is being overused. That can lead to hypertension. So one way to prevent that is to control that sympathetic system. Our autonomic system, the system which does not cross our cognition, is either parasympathetic or sympathetic system. The sympathetic system we use for certain functions. The most important function is something which is needed for our survival. So we are hardwired for that, which is basically fight or flight. When we see any danger, we are threatened, we feel threatened, whether from inside, from outside, our sympathetic system is going to react. Now what that does is it constricts our vessels. It moves the blood towards our musculature, our sphincters are closed, and our cognition is shut down. So when we think about that, our sympathetic system was actually meant to help us survive when we are threatened in a jungle, in a difficult situation. But nowadays, those difficult situations are not there, but we are still hardwired and we are very much stimulated all the time. And the food we eat also stimulates us. Now we are surrounded by stimulating news, stimulating things. Our relations are strained and they cause more stress on us, and similarly our food causes stress on us. So we are being stimulated from all corners. As a result, by the time we reach mature age, we become hypertensive. So one way is to control those areas, especially your relations, and especially if you have any fear. Remember, the fear has the physiology of sympathetic system. So you have to work on those. You cannot just say, look, I am like this, I have these fears, my strain, my disposition is like this, that I get angry, frustrated, and I'm an irritable person, so bear with me. No, you have to control. You have to become emotionally intelligent person if you want to control your blood pressure. Another action that would help you reduce your blood pressure is physical activity. When we increase our physical activity, our muscles are contracted. What happens is the collaterals open. These collaterals, if they are not open for 40-50 years, they will not open if we start too late our exercise. But for exercise, it's never too late. Collaterals still can be opened. But the only thing you have to do is you have to be very gradual. Aerobic activity, which means that our bigger muscles, they contract in a cyclical fashion. So jogging, walking, fast walking, swimming, stationary bike or bike, all these things are means to do aerobic activity. If you are starting an aerobic activity, make sure that there is consistency, and that consistency can be achieved only if you go very gradual. Otherwise, one of the joint or tendon will be strained or sprained, and you will stop the aerobic activity, and then after a few months you have to start it again. So aerobic activity will help not only open the collaterals. So when the collaterals, which are the vessel's side channels, are opened, what happens? The total volume increases, and as a result, that stretchability loss, that elasticity loss is compensated by the new channels opening, increasing the volume and reducing the pressure on the walls of the vessels. So this is how you can reduce the blood pressure. So now let's summarize this. We have to make sure what we are eating, what we are putting in our body. If it is too much stimulating, then we have to find out all the stimulating food. Of course, caffeine is one of them. Onion, garlic, chilies, spicy food, too much sugar, all these things stimulates us, and as a result we have blood pressure. The second thing is our mental strains, which is that we are in strained relation. Psychologically, we are continuously being bombarded with bad news. So we have to figure it out how we can manage in this ocean of distractions, and we make sure that we have good relations with others, especially with spouse and the people surrounding you at workplace and at home. If we can fix those things, the blood pressure, you can manage it very well, and you can prevent having high blood pressure, because all the medications that are given for high blood pressure have so many side effects that now your blood pressure is maintained, but now you have to deal with those side effects. In some other vlog, we will talk about the side effects of high blood pressure medication.